Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York on Long Island. And today one of our wonderful patients is kind enough to tell us about her journey within our practice in terms of entering perimenopause and the issues that can come along with that and how we've been able to help her. So I'll let you take it away.
Yes, I would like to first of all I would like to express my gratitude because I have been what worked for me before, all of a sudden it stopped working. I'm a perimenopausal. I just turned 53 in June. And what worked for me before, like I always was extremely active. At least I worked out 3-4 times a week. I also always watched what I was eating. And unfortunately, those things did not work for me anymore. I started developing a huge belly that grows from here. I also stopped, in addition to my weight gain, I stopped sleeping. I don't, usually never had any issues with sleep. Here I would wake up at 2-3 o'clock in the morning and I was just like totally, and I need to function, I need to go to work, I need to do certain things. And I was, for a long time, I was extremely frustrated and upset.
You were having hot flashes and night sweats and all of this as well.
Exactly. All of a sudden it was just hot, cold. I would never get a comfortable condition. And I'm extremely grateful to you because again, you helped me to figure out what works, like in the beginning. And again, it took some time to really learn what's working. Like, I know you put me on Vagovi, and in addition to that, I started working with Peter, exercise physiologist, and I was, and for me, what worked, it worked medication. When you found the proper, because again, those like I was constantly hungry. I could not control my appetite. I'm just coming out from dinner and I'm already hungry, and I couldn't control my appetite. So after you pretty much started giving me Zepbound and able to control, I took away this noise in my head that is constantly, I'm hungry. Second thing, I started actually moving to intermittent fasting, and my first meal it's at 2 p.m. right? So I don't eat until 2. I drink black coffee and I'm just running all,
some carbohydrate restriction too.
And yes, and thirdly, I just took out carbs. Like I eat vegetables, protein, and fruits. Those are, and fruits also I control sugar. Like I'm not eating grapes, I'm not eating carrots. Like all those things you and Peter helped me to to figure out what works. And I'm proud to say that from 168 pounds I went to 150.
That's wonderful.
150, and I have tons of energy. We were also like going climbing, and last year it was very challenging for me to walk, and I would take those breaths and I would be out of breath. And this year I did not have any issues. I'm physically, of course I'm working out, of course I'm drinking water.
But I believe you were working out back then as well.
Right, but again,
but more short of breath with the weight.
Yeah, it's a combination. I also do 3 types of training. Like I'm doing, stretching. I'm also, doing cardio, and of course strength training. Those are the 3 things, and I break it down.
And this program was developed by Peter, our exercise physiologist.
Correct.
For you.
Correct. And again, when you sleep, and I don't know if you would like to cover a little bit about the medications you gave me, but I don't have any challenges of sleeping. And when you don't sleep, it's one thing triggers another. It means you cannot work out. You start eating crap, and you
tend to crave all those unhealthy things, and your appetite increases too.
And it triggers one thing, triggers another. So I think when you really come back to the basics and you sleeping enough and you you have time to plan, you have time to, and strength and energy to go and work out. So I'm just extremely, I went from size 10 to size 6 right now. I'm extremely happy, aesthetically. I can fit in all my clothes and also again, it's physically much easier to move around. And yeah, I'm extremely grateful to you.
Oh, it's my pleasure, our pleasure here. These are the kinds of stories that we love to hear and to be involved in the process. So in terms of the hormone replacement therapy that we've started with you a month or two ago, and we're using for you a transdermal estradiol or estrogen patch, a low dose, and also micronized progesterone, a low dose of that as well. How has that been helpful to you?
Again, I started sleeping. I think it's a huge plus. But
what about the other, what we call vasomotor symptoms, the hot flashes, night
it's
sweats?
all gone. I don't feel anything. I mean, this is a huge plus. I mean, I also, I have a history of migraines, and unfortunately, my migraines came back. I mean, there's a downside, but I'll deal with my migraines. But I need my 8 hours sleep, and I really need.
Right, and hopefully you'll adjust because, and I know that your menses, your period where it was a trigger for your migraines in the past, and also barometric pressure and stress and so on. They're all very common, all three, as triggers for migraine. But it would be that fluctuation in your estrogen during your menses that would trigger the migraine, or right before your menses. And so using a low dose of the transdermal will hopefully create a nice stable estrogen level in your blood, and also not cause the spikes that you might get with an oral estrogen, for example. So hopefully you're going to adjust. It does sometimes happen that, especially for women whose trigger for their migraines was their menses, that to put them on estrogen may increase their frequency. But of course, I also give you medication to help with the migraines as well. That seems to break them most of the time for you.
Yeah, and I'm also extremely grateful. Again, I mean, the biggest learning moment, you need to reflect, right? What works, what doesn't. I have a diary that I actually keep track. I mean, usually 3 things always triggered my migraines. I mean, first it's menstrual cycle. Second thing, it's stress level. And thirdly, biometrical pressure. Like when the weather changes, it's also extremely, and when you start tracking, and also to learn when really it's coming in. If you're taking medication in the beginning, you can prevent this pain for 3-4 days. Like if you miss this and you're getting into it, then everything starts like with throwing up and.
Right. And we needed to adjust that medication a little bit, quite a long time ago. You didn't tolerate oral sumatriptan.
And
we moved
spray.
to the nasal, the spray, and that seems, as you said, you can abort the headache if you act quickly enough.
Right, correct. But again, among all my peers, I mean, there is such a huge stigma about HRT. People are so extremely afraid. And I honestly think that you just have to go with what it's available, and also trust to your doctor. Because
right, and so I've spoken about this a little bit in other videos that we've recorded, but the thinking about estrogen and progesterone therapy for women in perimenopause or menopause has changed greatly since the Women's Health Initiative study came out a little over, I believe 20 years ago now. That study used a totally different form of estrogen and a totally different form of progesterone, and most of the women in that study, the average age was, I believe, 63. So now we know that starting estrogen earlier, around the time of perimenopause, even before menses have ceased entirely, and then extending it for 10 or so years up to age 60, and then it becomes a little bit more of a nuanced discussion about whether to continue it. But the linkage with increasing breast cancer risk has really been seen not to be the case on re-examination of the WHI data, and also the fact that we're not using conjugated equine estrogen, horse-derived estrogen anymore like they did in that study, and we don't use medroxyprogesterone acetate anymore. We use micronized progesterone. So I know that a lot of that worry carries over from what was kind of a misinterpretation of the WHI data that the press then got a hold of and really ran with it and scared everybody in terms of patients and doctors away from giving what really can benefit the health and quality of life of women, took it away from a lot of women who really could have benefited. And it's FDA approved for those vasomotor symptoms, the hot flashes, night sweats, and so forth, insomnia, mood changes. But we also know that cardiovascular disease risk increases as a woman enters menopause. As the estrogen goes down, it approximates what the risk is in a man, and risk for dementia, many other things that I've chatted about in other videos. So I just wanted to say that hormone replacement therapy, you always need a very good history. You really need to know your patient very well to have that nuanced conversation about whether it's appropriate. But the thinking about its safety and appropriateness has changed an awful lot in the last few years.
Yeah, and the same thing with the GLP-1s. I mean, there are so many people that extremely afraid of taking the medication, but if you think about how much obesity causes in terms of damage,
Of course.
you know, its benefit, it's outweighs of risk,
Absolutely.
right? And
Absolutely.
you know, you have how many types of cancer if
13.
you're obese?
Associated with obesity, 13 at least.
Yeah, so we had a patient recently who had cancer of liver, and the specialist, he said to him, when he asked why did this happen, he said 3 things, right? I mean, either hepatitis, second thing if you drink, and third
Neither
thing,
of which were the case for him.
right, or if you are fat, like if you obese, and this particular
and he
individual.
unfortunately, he had not watched his weight his whole life. He's now in his early 80s, and thankfully it was just a localized tumor in the liver, no spread anywhere, taken out surgically, and he's doing well. But that does, as you say, absolutely illustrate the importance of controlling one's weight, because in addition to increasing risk of heart attack and stroke and osteoarthritis and sleep apnea, one that people may not be familiar with is increased risk for cancer, liver being among them.
Yeah, I'm very grateful. Again, I mean, I think the risk of cancer detection, you're also pretty much on the top. Like, you pushed me to do pre-screening, full body
And your
MRI.
annual mammogram and so forth.
We do need to do those pre-screenings and really keep track. But
Prunuvo is the whole body MRI that we arrange for our patients here in the practice.
Yeah, so thank you so much for taking such a great care of your patients.
It's our pleasure. Thank you for sharing your story. So if you would like to learn more about our practice, we are Northeast Medical Practice, located in Great Neck, New York. The phone 516-604-3418. Of course, we're on all the social media channels. We have a YouTube channel, and we have my podcast called Longevity MD on Spotify, where I talk with other physicians and about all topics related to optimization of health. And I always need to mention too that everything we share in these videos does not constitute medical advice. No doctor-patient relationship has been formed, and if you have particular questions or concerns about your health, please don't hesitate to reach out to your medical professionals. But until we see each other next time, be in good health.
Thank you. Bye-bye.
Yeah, you think it was good?